Hi, Dr. Yass here. In this video, I want to discuss this trend that's developing, which in my mind is extremely dangerous. And that is the opening of these facilities called spine and pain centers, which are cropping up on almost every corner now. And it is trying to create the sense that you can have your pain resolved wherever it is, as long as you're willing to accept the concept that the pain is coming from where? What do you think they're trying to promote? That the pain is coming from your spine. If you look at these facilities, they're going on the same premise that we had in the 1990s and early 2000s of pain management facilities popping up on every corner. And the premise was that you didn't have to necessarily go to a regular physician. You didn't have to go to a hospital. You could just go to your corner pain management location and they'd be happy to dispense you the synthetic heroine, which was being promoted as prescription pain medication. This is the same exact premise. It literally is the same thing going on, but in a different cover. And if you look at the concept of the name, the title, Spine and Pain Center, what's happening is the same thing that's been happening over the last 40 years, which is not an attempt to prove medically or scientifically that pain results from the spine, which it doesn't. There actually is no basis for that statement. In fact, the Yas Method has shown that in more than 98% of cases, the cause of pain is muscular, even when structural variations are identified on MRI or X-ray. But the attempt is made by putting these on all the corners around the United States that, well, if they're out there, it must be true. So therefore, just accept the idea that your pain is coming from your spine, regardless of where it is, from your head to your toe. You have to see this as an attempt to coerce you into thinking something that has no basis of fact. The use of the MRI developed in the mid-1980s, over 40 years ago. Its attempt was to promote the idea that pain could be identified by getting images of the spine and finding structural variations, herniated discs, nerve root impingement, stenosis, all this type of stuff, and then simply asserting that the cause was from that because it was found for the first time at the time of your pain. They went on and created psychotic diagnoses like neuropathy. The premise that the cause of your pain is a pathology of a nerve without any physical presentation to justify that diagnosis. There's nothing physically to say that you have neuropathy. Simply a neurologist says it, and you're supposed to accept it. This has been a extreme failure. Extreme failure. There's no other way to look at it. Every bit of evidence proves it. 130 million Americans, 1 billion people worldwide suffering from chronic pain since the advent of this methodology. Depression rates skyrocketing, suicide rates skyrocketing. There has become a cultural acceptance that chronic pain and chronic illness are the same, that they're synonymous. It's insanity to believe that. Chronic illness relates to the idea that some tissue is deteriorating as a result of a pathology. Chronic illness, chronic pain is the fact that you have a tissue in distress, you have not identified it properly, therefore that tissue continues to be in distress and elicits the emergency distress signal of pain. The reason you have chronic pain is not because of deterioration of a tissue, but because you haven't identified the tissue in distress creating the pain from the very beginning. There has been a mass coercion of the population culturally Chronic pain is not a medical issue. It's not a medical disease or entity. It's a cultural entity. It is a preposition that you are willing to accept the way your pain is being diagnosed universally, primarily by diagnostic testing, and that whatever is found is in fact the cause of your pain. And then you just continue to go on getting varied treatments. You get multiple treatments from multiple practitioners. You're spending money, time, and effort, and you're still in pain. Chronic pain has never existed prior to this period. In the history of mankind, there has never been chronic pain. Chronic pain began in the late 1980s, early 1990s, and has been present since. You have to see that as a question as to why now? Why has chronic pain only occurred and consistently occurred for the last 40 years? The answer is that, first of all, the massive number of people who ultimately ended up having pain has expanded from people who are retired, which is the only people that really were suffering from pain prior to this period, to now people all the way down to their teens and 20s. Why? The advent of technology. Technology has led to the idea that people simply don't have to use their bodies as much, whether it's manually for work, manually for recreational activities, manually for anything, watching TV, turning the TV channel. For God's sakes, you use a remote. And even with the remote now, you don't even have to press a button with your thumb. You can simply tell the remote what to do. As a result of this, people across the world of all ages simply stopped using their muscles. And when they did try to do something manually, the muscles strained and elicited pain, which is why you now have a massive, massive population growth in those suffering from pain. But that doesn't fully identify why it became chronic. The reason it became chronic is because with all these people globally seeking a means to identify the cause of their pain, as an advent of that same technology that was developed in the mid-1980s, the MRI was developed, which falsely identifies structural variations that exist independent of the cause of your pain, which is muscular, and therefore you're being treated for structural variations that are not eliciting your symptoms, which is why the muscular deficit continues to elicit your symptom and will continue to do so indefinitely until you properly identify that as the tissue creating your pain or altered sensation. So this is a critical thing that must be addressed and must be understood. If you are to resolve chronic pain, you must understand its etiology. And the reality is it only began as a result of the use of the MRI and technology, leading to more and more people having muscular deficits, making them susceptible to straining and eliciting pain. That's it in a nutshell. So this idea that the medical establishment, by the way, I am so disturbed by the fact that these facilities are actually supported and promoted by universities. They have their names attached to these. So these aren't just local practitioners setting up these spine and pain facilities. You have universities setting them up. This is a horrible precedent. It gives great credibility to the idea that a spine and pain facility is the only place you're going to be able to resolve your pain. And the idea that, in fact, the pain is coming from the spine, which is just lunacy. No credible, theoretical, clinical, or scientific evidence proves that. In fact, theoretical, clinical, and scientific evidence proves just the opposite, that the premise that pain is coming from some structural variation at the spine is in fact baseless. So please think twice when you have pain and some medical practitioner is trying to convince you that the way to go is through attending a spine and pain facility. These are no different than the pain management facilities that developed in the late 1990s. They just have a different cover around them. The premise is still the same. We're going to find structural variations that are creating your symptoms. We're going to justify it without any basis that that's causing your problem. We'll try a bunch of surgeries and nerve blocks and all this other stuff. But ultimately, when you're still having your pain, you will be left with the same two choices you had in the 90s and 2000s, which is that you will either be subject to pain management for the rest of your life, or you will simply be told that you have to live with your pain indefinitely. And that's where we stand. It's no different. We're 40 years down the road. We are in the same place we were from day one. So please do not buy into this idea that just because on every corner there is some spine and pain center opening, that somehow justifies that it's a credible, viable way of diagnosing and resolving your pain. Okay? Please, if you're looking for a legitimate alternative, then look to the Yas method, which actually does not look at diagnostic test findings, but interprets the body's presentation of symptoms, which is the attempt by a tissue in distress to create conscious awareness of the distress of that tissue. Every tissue creates specific symptoms. So if you have specific symptoms and you could interpret those symptoms, you could tell what tissue is creating those symptoms and then be able to provide an intervention to resolve the distress of that tissue. Well, it turns out after 30 years and thousands of people, I've been able to show that in more than 98% of cases, the cause of pain is muscular. Even when structural variations have been found, people come to me every time and say, I'm an L1, L4, L5, herniated disc or pinched nerve. I'm a meniscal tear. I'm a bone on bone. They're identified by the structural variation identified. And yet, even with that, I've been able to show that the cause of pain was muscular, and those are independent findings which require no intervention. So if you want a legitimate way of understanding what tissue is creating your symptom, you need to interpret the symptoms, and that can only be found through the Yass method. So if you're looking for something legitimate, viable, scientifically proven, theoretically and clinically proven, you want to have the Yass method, okay? So if this video is helpful to you, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added. If you would like to contact me, you can contact me by email at drmitch@mitchellyas.com. If you would like to set up a Yas Method appointment, you can do so by going to my website, livewithoutpains.com. You can hit the Schedule Now button. That will allow you to make an appointment either for an in-person session in Jacksonville, Florida, or a Zoom session, which can be performed internationally. I have been doing the international Zoom sessions for years now. They are highly effective. You can come to an understanding as to what's causing your pain and quickly and effectively resolve it and return you to full function if it's proven to be muscular, which I have done so in more than 98% of cases. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.